My name is Russell Preston. I'm a psychiatric nurse practitioner. I've started my own practice called Working Health in New York City. It is a psychiatric practice that does med management and psychotherapy. So I am a person under the LGBTQIA plus umbrella myself, and just growing up younger, I always wondered as I was going through what my coming out story would be like and things of that nature, what my quality of life would be. Began to volunteer at certain, and prior to like kind of nursing school, volunteer at nursing homes and Sage, hearing all these rich stories from, these LGBTQIA elders and just learning how through various different generations we've had different qualities of life. It just made me just want to learn more about the association between stigma, discrimination, and minority stress, and how all of that plays a factor in health, especially in quality of life in those that are older. Well, some of the key findings I found that they're in four key areas of mental health, physical health, social support, and resilience and coping. There are higher rates of depression, anxiety, and psychological distress compared to the heterosexual peers. And that is through a strong association with stigma, discrimination, and minority stress. There are more LGBTQ elder adults or older adults report more chronic conditions with physical health, such as cardiovascular disease and physical ailments and disabilities. And those tend to be barriers due to finding the ability to access affirming healthcare. Social support plays a really protective role, but not in the traditional sense that community and chosen family play a protective role, and that strong support linked to improved resilience and well-being. These persons, through demonstrated adaptive coping strategies such as activism and community engagement, and then the resilience often offsets risks, but cannot fully erase the structural inequities. The implications for practice are, as providers, is that we have to continue to work to create inclusive and affirming healthcare spaces for our LGBTQIA elders, that training for, our psychiatric nurses and other providers on cultural competency is really, really important. We have to continue to work on creating expansive supportive services and policies to protect our LGBTQIA seniors and, continue to encourage these community-based programs to grow so that these communities can continue to foster resilience and belonging. I would say that honoring where they come from is coming from an affirming and cultural competency way. So being sensitive to a patient's or a person's lifetime experiences of discrimination and making sure that they feel safe and respected in healthcare setting. For me, as I was writing this article, it reinforced for me how important it is to create inclusive and supportive care environments because that directly correlates to a quality of life for LGBTQIA elders. And in many spaces, because they aren't accustomed to having these affirming spaces, they feel like they can't speak or be heard. And so, as providers, it's best that, especially as they're facing ageism as well as the stigma of being LGBTQIA as a double minority, it's imperative that we sit and listen, not try to rush, and really honor and respect what they've dealt with while creating that supportive environment, giving them the resources that they need, and giving them the education so that they feel empowered and safe to ask questions and even challenge the providers in ways that it can be a collaborative environment. As the US population is aging rapidly, that means, and due to modern science, that there means that there are more LGBTQIA individuals that are reaching older adulthood than ever before. So there really is this urgent need to understand their unique experiences and their health outcomes. Ageism and LGBTQ stigma, we really have to pay attention to both of those disparities so that as advocates for our communities, we can, go to our policymakers and make sure that we are creating the safest communities possible. I hope that my research, as well as any others that are empowered to do research like this, can influence policy by underscoring the need for inclusive long-term care facilities, non-discrimination protections, and supportive community programs.